I'm Richard Frieder. I'm the Director of Community Engagement here at the Hartford Public Library, and I'm very pleased to welcome you here. Matt Poland, our CEO, was hoping to be here tonight, but he could not be, so I'm welcoming you on his behalf. And we are delighted to be working tonight with the North Central Regional Mental Health Board and the Asian Pacific American Affairs Association to present this Health Equity Forum. I don't need to tell anybody here how important health equity is and that everybody deserves access to high-quality health care. And we're certainly not going to solve all of the challenges around those issues tonight, but I hope and I think that by the time we all walk out the door, we will have come a little bit closer to improving the situation. So the library is really glad to be part of the partnership that has made this event happen. There's a full agenda, so I'm not going to take any more time than that. Just to say once again, thanks for coming and welcome. And I think a lot of you have been here in the library before. Who is in this library for the first time tonight? Okay, well, a bunch of you. Well, welcome, especially to you. And I hope you and everybody else will come back often. We have a pretty amazing array of things going on here at the library, programs and activities and services. So much that I can't keep track of it myself. But I do invite you to come back often and take advantage of what we are offering here. So, welcome again. And now I'm going to turn it over to Quen.
Hello. Thank you so much for taking the time on this day before Thanksgiving travels and snow and all this craziness. I want to acknowledge that you all took a lot to come out here. I'm also so excited to see such diversity in the crowd. And I wanted to ask how many of you are providers of services? Can you raise your hand? Awesome. And how many people are from Access Health Connecticut? Did anybody come from Access Health? Nobody made it. And then how many are participants in the conversations that we had? Awesome, great. Well, thank you for coming out. So we are gathered here tonight to kind of talk a little bit about the report that we came up with based on the 12 community conversations that we had over the summer. And we also wanted to have a panel of people, of community leaders who have worked with the Affordable Care Act, talk about the legislation and its impacts, and give you a chance to address issues that have come up and to come up with solutions with one another. So to move forward, I wanted to give a chance to each of our panelists to introduce themselves, and then we're going to launch right into the panel discussion. So I wanted each panelist to say their name, organization, and your work with the Affordable Care Act.
Good evening, everybody. We're happy to have you here. My name is Josie Robles, and I am the CEO for Hartford Behavioral Health. And we participated as in the Affordable Care Act and enrolling and educating consumers around the insurance and the new program within the Affordable Care Act and how to be able to enroll them, whether they were online. We had a staff member that was an assister, and we provided bilingual services so that those Latino monolingual consumers that could not understand the language and understand the whole process, we were able to support them. We held some community activities right at our site, at our 2550 Main Street site, and also at our, which is the north end of Hartford, and we also provided services at our 1 Main Street site, community services, and where we enrolled consumers and anyone who was interested in getting enrolled in the new insurance program.
Good evening. My name is Moy Hin McCormick, and I'm Executive Director of Asian Pacific American Affairs Commission. So for those of you who don't know, we have a state legislative commission that actually oversees the issues regarding the APA communities in Connecticut. And our commission is charged in trying to improve the quality of life for the Asian Americans throughout the state. The work that we've been doing regarding the ACA has been on a variety of different levels. We've been trying to work in partnership with North Central Regional Mental Health Board and other community organizations and state agencies to actually bring the messaging of the importance of being able to enroll, and then also understanding what enrollment is. So, after enrollment, what does that actually mean to individuals and families? How do you actually access services? What does the process look like? And identifying resources within the community where individuals and families can ask for assistance in addition to learn additional information. We're very pleased to continue partnerships with a variety of different organizations, and we look forward to continued work that we can do as a larger community. Thank you.
Hi, everyone. My name is Denise Smith. I'm a community health worker. I had the pleasure of working for a community-based program, the Navigator and In-Person Assister program, as the training coordinator. It was a community-based program embedded in the Exchange in Access Health, Connecticut. My role was to design the training modules as well as the certification exam and provide continuing education for navigators, in-person assisters, certified application counselors, and brokers. So I didn't get out of the office much, and it's actually a pleasure tonight to see some of the assisters who are here and still coming in. I won't name everyone, but I was just shaking their hand and again thanking everyone for the incredible job that they did during last open enrollment. We have much to share. You have much to share with this group. And so I honor your service, and it's good to be here. Thank you.
My name is Alphonse Wright. I am retired. I am also sit on the Connecticut State African American Affairs Commission, and we are very interested in any issue that affects the African American community in the state of Connecticut, and health is one of them. Also, I was a facilitator in the community conversations with healthcare. And before I retired, I also sold health insurance for 9 years, excuse me. So I have a little bit of background in that arena, but I'm also very interested in how this program, the ACA, affects everyone. Because I have found out by being a facilitator in other avenues, there are individuals or families who have, quote, full health coverage, but some of the questions that came up out of those conversations in terms of, I have a daughter, or I have a son, or I have a parent who needs some assistance, how do I do that? And it fit right in where the ACA has been making an inroad. So I'm looking forward to forwarding that, and thank you for your time, and thank you for coming.
All right, so we're going to launch right into our questions. We only have a couple of questions for the panelists, and then we're going to take questions from the audience from those index cards that you were asked to fill out when you came in. So the first question for the panel is, what is the Affordable Care Act?
Wow. Okay. Well, for me, it's not Obamacare. Let me just start by saying that. For me, it is the Patient Protection and Affordable Care Act, passed in March of 2010 and steadily being implemented. So in my role at Access Health, developing the training, I had to spend a lot of time reading the law. It was my job to, in some way, extract the key concepts and terminology of the law that was relevant to the implementation of the exchange. I had no background in health insurance, right? I was a community health worker, a HIV early intervention specialist, a youth worker. I was a street outreach worker. So it was definitely breaking ground for me. There is what is widely known as the triple aim of the Patient Protection and Affordable Care Act. And it is important to say that there are 10 sections of this law, the vast majority of which are almost never spoken about. And maybe we can get into some of that tonight. But the main focus of the triple aim, right, the triangle kind of underneath the law, is to reduce the cost of care, to improve healthcare service delivery and the actual delivery system. And that has many ramifications for the workforce as well as services. And also just to improve the quality of that care. And we are absolutely at the very beginning of that journey.
Yeah, and I'll just add on to what Denise indicated. So, you know, when I hear Affordable Care Act, I think of benefits. I think of health coverage. And it's really important for all of us as leaders within our own communities and larger communities to bring that messaging across to individuals and families that actually don't get the opportunity to hear the important details of what this means. And it also means to be able to bring it to people and put it at a level where they can understand it. So whether we translate materials so that individuals can really understand what information they need to make decisions about, or to have interpreters available to really be able to inform individuals and families as to what decisions they need to make that benefit their well-being, right? It benefits their children, it benefits themselves. So really, it's about the coverage piece, it's about the access piece. The access piece brings up a lot of questions about barriers that all of our communities face, the cultural barriers, the linguistic barriers, and it's really trying to identify additional resources that have the capacity to address these issues. And we're hoping to be able to learn from each of you, and we're hoping to continue this conversation, not just, you know, leave it at tonight, but really to have additional conversations, to be able to bring this messaging out to more communities, to really clarify misconceptions of the ACA enrollment, and, you know, when people have issues or problems, to help them get resolution to that.
As a subset of what has just been said, there's also the focus on getting more people enrolled. There are, about 20 million people in the United States now that do not have health insurance. Now, normally you would not think that's an issue. However, when something critical happens or major happens and they don't have the coverage, people are sometimes afraid or scared or will not go and get the proper health coverage that they need. So there is that whole idea of enrollment, get more people enrolled and get them to understand the benefits of it and the good use of health insurance. As a quick example, a lot of people go to an emergency room and use that as a primary, quote, doctor situation. It doesn't work. Primary care is something that's an ongoing basis and not just when the emergency happens. And if there is ongoing health coverage, there's a greater probability there'll be fewer emergencies, and that'll also help contain costs.
And I just wanted to lastly add, Affordable Care Act for me, to bring it home, is to be able to have the opportunity for healthy living, to be able to have the opportunity for preventive care, so that you don't have to wait until you're really ill or a disease is more progressive when it could have been preventive, and now you have the insurance to be able to do that. Also, to be able to not fear if you have a long-term illness and fear that you may be dropped and no longer be treated because of the capping or the maximizing. So those are kind of some of the points that I felt that it's more beneficial for us through the ACA Act.
We're just going to ask one more question, and then you're welcome to ask a question, unless it's directly related. Okay, sure.
About almost a year ago, I was invited to Thanksgiving dinner, and in the middle of the dinner, I happened to ask him, what do you think about ACA? And a friend of mine looked at me and praised me, it's not affordable, it's unaffordable. What do you think about it? He said the ACA actually is not affordable, it's unaffordable care act.
That's a very good question. And what I have found is we have to be careful in terms of what we hear, and then when we hear something, it may be good to go ask a few more questions to really understand what is being said and how it applies to you. That's very important, because there's a lot of folks out there who want to do as much damage to the ACA process as they can. So I'm inclined to say, if you hear something, ask a few more questions so that you can better understand to find out what it's really about. And the ACA is affordable, and it is there to solve some very serious issues.
I would say that affordable means a lot of different things to a lot of different people. I would say that affordability is related to your priorities. And so if you have not prioritized your health, particularly preventive health, building in the cost of copays and your prescription drugs and health benefit savings accounts or paying for health insurance, if you haven't done that before, I could find a whole host of reasons why this would not be affordable, right? And I think that that is part of the conversation that hopefully was started last year by many of the assisters, yourself included, to sit down with people in a very intimate conversation and begin to talk about their own ideas of health, preventive health, and how they are going to engage with the healthcare system. So I agree that the word itself can be very contentious. There are issues around having this individual mandate and everyone being covered, right? There are those issues, and the aspect of the penalty that can be imposed, the tax penalty, if you are not covered, right? And so, as Alphonse said, a lot of times we begin the conversation for someone who has not had insurance by saying, let's look at what the cost might be for you to enroll in the marketplace, and then let's look at the cost of one catastrophic event. Okay, just as an example. And let's try to compare that monthly cost to the cost of that catastrophic event, right? That's one way to engage people in talking about the numbers. There are other ways to engage people in talking about the affordability. For some people, they just have never budgeted for a health insurance premium. Right? So for those who have to pay, maybe they just have never put it into their budget before. And I had heard many stories from assisters who had to sit with people and just say, can we find this $65 in your budget? Because for some people it was an issue of, I don't know if I can. I mean, $65 might sound like a good deal, but I just can't find it. And sometimes people just need help in that budgeting. So there are a lot of different levels to that conversation.
And it's also important to continue asking those questions. So, good job, Nee, for being able to draw some conversation and have some actual discussion about that. It's difficult to resolve any type of issue, especially when it comes to health insurance. Without a doubt, it's important for us to continue the dialogue, to continue having these conversations, to continue identifying what the barriers are, to continue, our attempts to addressing and making resolutions to some things. That's why we're hosting something like this as well, too. And we want to continue, with community conversations, community dialogue about the ACA. There's a lot of misinformation that's being out there, or misinterpreted or misunderstood. In addition to, there's, a lot of people who don't know what the information is. So it's important for all of us, for each of us that do know about the ACA coverage, enrollment, and the benefits and the specifics, it's important for us to help clarify some of that, in addition to bringing these real barriers to the people that need to hear it as well, to try to make attempts to, change certain systems that aren't working.
And I would just like to acknowledge this gentleman for asking the question, because that is so vital. As an example, I'm a Mason, whatever that is, right? Anyway, we had a meeting the other night, and we had a person come in to talk about financial planning. Now, all of the people that were in that meeting are probably about 45 or 50 who are full, well-employed, who have some sort of pension or retirement program and are thinking about Medicare or Social Security. The presentation was a good presentation, and it was kind of quiet, and one person asked a question, and when that one question was asked, it helped, or it took away the stigma for other people to ask questions, because the nature of the questions that were asked, one would think all these people already knew, but they did not know. So I just really want to acknowledge you for asking that question and opening that up to give people the freedom to ask other questions. Thank you.
Can I add to that? My name is Ji Huang. I was a sister last year, and I'm a sister this year. And I heard people say many times that, why do I have to buy insurance, health insurance? I don't use it. So if it costs $30, $40, or $50 a month, it's not worth it for me. So I think that the simple way for me to explain it to them is this, is look at this. If you buy health insurance, you have physical exam free. Free to talk to your doctor, free for on the lab test, on the x-ray or whatever relating to the physical exam. That alone probably could cost hundreds and thousands of dollars. And I also tell them that. Are you driving a car? If you drive a car, are you changing the oil? Are you changing your brakes once a while, or at least, a few times a year? If you don't do that, what happened to your car? Mm-hmm. So people say that, wow, I never thought of that. Mm-hmm. Even I'm healthy, but I should have, physical checkup, every year. So if doctors see something, they would find out now instead of later. So, people sometimes just think in a simple way. Sure. So I usually, explain them like that. And then they would think that, yeah, it makes sense to buy health insurance. And those health, if they buy, I think that it will lower the cost of the ACA because of the fact that they are healthy. Because we try to get as many healthy people go into the program as much as possible, not just only the sick people. So that's what I say.
You're bringing up some great points. So you as a community member are of value to what this messaging is all about. We cannot do this messaging without the community members and without the investment and passion that each of you have. And you're able to kind of interpret the language, right? So you know the information about the ACA, and what you're doing is you're helping community members to understand by providing them true examples where they can relate to, and they can feel more comfortable in making appropriate choices for themselves. It's kind of like you're the ambassador, you're the representative, you're really able to speak to the community. We need more community members like you, like me, like others in the room to really continue the messaging and to address the questions that are coming up and to address the misconceptions that are coming up as well too. This is really about maintenance of overall health. We want to be able to have healthy Americans, regardless of your race, ethnicity, gender, sexual orientation. It's about a human right, and it's about being able to have that right in all of our communities and be healthy. Each of us deserve the right to be healthy, and each of us deserve the access to be able to maintain that health.
Right. And just going back to your car that need oil change and maintenance, for those that feel that they don't need to go to doctors or get health care because they're healthy, they've never been sick, they don't even have a cold. Getting back to your car, you need car insurance, vehicle insurance. Well, I'm a great driver. I've never had an accident. But the person that day that I do have an accident or something does happen, I have insurance. Plus, it's not a choice. I can't drive my car unless I have insurance. So I think that the message that we try to drive is, and I think even President Obama, is that, it shouldn't be a choice. We should have health insurance so that we can live longer lives and healthier.
Also, if I just may quickly, And just another example. My daughter got cancer the first time when she was 17. I had health insurance. It was pretty good, you know. I didn't think anything about catastrophic anything until after my daughter had cancer. And she had cancer in, 1979, somewhere around there. Her cancer bill was over $300,000 then. Then. I'm thankful that I had insurance. Before that, everyone was healthy. You know, all we had was just the regular colds, the regular checkups, you know. But until something catastrophic happens, most people cannot really get their thought process around the impact that can have, not on you just financially, but psychologically as well. And so if one piece is taken care of, the financial piece is taken care of, you're probably going to be in a better position to handle the psychological piece also. So that's important. And just another point that was made, culture has a lot to do with who doesn't get health insurance. So the fact that there are people who can understand whatever that culture is and interpret it for their community, that's going to be a great assistance as well.
Great, and that perfectly kind of leads into the next and last question that I have for the panelists, which is how has the Affordable Care Act impacted different minority groups? You can draw on the report that I shared or anything else that you have.
I think, I can speak on behalf of the Asian communities that we represent. So for those of you who don't know, we have a lot of countries that we represent. Typically, when people hear of Asian Pacific Americans, they think of the ones that you hear in the media, socially. You hear of the China, the Japan, the Korea. You don't really hear about the Burma, the Thailand, the smaller countries that actually have underserved populations coming to Connecticut that really need basic needs. They need housing help, they need educational services, they need health-related services, they need financial services. So we're really talking about kind of grassroots, needing as many services as possible, as quickly as possible. The ACA has really been important for us to be able to try to bring information that's useful and needed to our communities. Culture is huge. If health insurance is not one of those top priorities in the Asian culture, probably similar to a lot of different cultures as well too. So if you're not coming from a culture that prioritizes health insurance and understanding of, you may not be able to relate to what's been said or seen when it comes to the ACA. What people can relate to though is, illness, or when they're feeling not so healthy, or when it comes to the point where they can't bear the pain anymore and they feel like they have to see somebody. One of the first choices that our Asian communities, like other communities do, is they resource to the emergency rooms. And unfortunately, our emergency rooms are not equipped to handle the mass amount of individuals and families coming to them because of various needs. So I think, the ACA messaging for our community has been critical to try to bring this information to change the perception that, you don't have to be sick in order to access and gain insurance. It really is about preventative health. It's about trying to maintain the good health that you do have. It's about addressing your health needs. If, unfortunately, you are diagnosed with or come down with something, it's trying to be able to resolve and improve your health, your physical health, your mental health, your overall health. And I think, for our commission, we've been trying to prioritize bringing this message to underserved communities within the Asian population. We absolutely can't do it without community members, so that's why we are always draw to, and we're very thankful that we have community leadership, we have community partnership to be able to bring the messaging, to be able to share the information, because it's also about relationship building, right? If we're coming in as a state agency and people don't know who our commission is and they don't know the faces of our commission, they're not going to trust. But if we are coming in with a community leader that they do trust, now they're going to listen to us even more because they have the partner right there that is within their own community that they do trust, that they have seen do good for their community. they can now start opening up and accepting some of the information that we're able to provide. So I think, you know, the prioritizing and the importance that I can't stress enough, we need community members to be part of the process, and that's something that our commission is really trying to push forward. We don't want it to be a delegation of things, right, from top down. It's really about let's equal the playing field and bring people who are needed that represent various communities, regardless of where we're coming from, but who can actually bring this important message to different communities and populations. And let's try to work together as a larger group, because resources are limited, staffing is short, funding is scarce, and that's our reality. So it is about, you know, trying to figure out what resources we have and how we can try to pull things together to really make it work and address the various things that are going on.
So in our culture, Latino culture, oftentimes we're afraid to go to the doctor's, period, and it gets compounded by not having insurance, and so therefore we wait, and as we stated, we end up going to emergency rooms, but also not being able, because before the ACA Act, those that didn't have insurance, they were already afraid to go to PCP, and then not having the insurance allowed them, the result of it was that it deteriorated their illness. By the time they go to the doctors, it's something that could have been preventive. It's much more complicated. It results in surgery. And sometimes it may even result in being too late. And so by having insurance demystify that barrier, and also the awareness that has come through this program, and being able to live healthier and do preventive care. So we have that opportunity to educate our Latino community to say that they can have access to care, and they can get it now without being afraid of not having insurance, or being turned down, or being turned away, and being embarrassed.
I think it's had some benefits. I don't really like the term minority. Let me just say that, because I just think differently about the world. So, but I understand. I'll come at it from a linguistic diversity and a cultural diversity perspective. The ACA has given a lot of groups in the state of Connecticut an incredible opportunity. In July of 2013, and some of you were at that meeting, we had a kickoff meeting for our Navigator and In-Person Assister program. There were over 700 people in the room, and they were representing over 33 different languages, including French Creole, which is the second most widely spoken language in the state of Connecticut after Spanish. We had Farsi and Hindi and American Sign Language and Tagalog, and on and on and on. And this law and the creation of the exchange and integrated eligibility and open enrollment brought together organizations that had not worked together before. Granted, it was a grant process, and it was a very challenging, very frustrating process for many people, but they struggled through it on behalf of the individuals that they were representing. They came through this very challenging process. As Moy Moy said, that federal grant and all of that money that came into the state of Connecticut was gone almost as quickly as it came. And we know that because most of us have some sort of relationship with the grant cycle. The money comes and it goes. And so the challenge now for those diverse cultures and those diverse language groups that came out to say, we've been waiting for health reform, we've been waiting for the opportunity for people to have access, we now have to struggle with what are we going to do now when the resources change? Because we cannot wait for folks in Congress to allocate funds We don't know how long that will take, and we don't know how much will be allocated to our state or to a particular program or through a particular foundation. We just don't know the ebb and flow of the politics. But we know that if we believe that healthcare is indeed a right and not a privilege, if we believe as a community that we should share the risk so that when our cousin and grandmother and neighbor and coworker becomes ill, right? Because we just don't know who will fall ill, but someone that we know will fall ill, that we are saying we're willing to share that risk so that someone doesn't lose their home, right? So that their children can still go to at least a community college, right? We have to be invested in that idea. And so with that idea, and Moi Moi has echoed it throughout the evening, we have to continue this conversation. The question for me is, what now? You know, what now?
Is that a song, What Now, My Love?
I don't know if that's a song. I don't know. If it is, he'll think about it.
You have to excuse me.
You got
know.
a couple years on me. Not
Yeah,
many,
you
but
know.
you. So you might.
When you get past 70, you're allowed to do that. You don't have to explain it. But on the culture side, you know, when I was doing the facilitator, some of the conversations, especially for the, I'm going to call it black community,
Yeah.
there were some things that came out that I was aware of, but they were really expressed. One, older black people do not like to go to doctors. Don't trust them, for whatever reasons. But there is a very good reason why they don't. There's something called the Tuskegee experiments, way back when they specifically did experiments on blacks without letting them know what it was, and they went through all that. So there's that. And then there's this newfangled stuff.
Yeah. Yeah.
And that's the word that's used. It's new. I mean, you know, and I've been through some of those transitions. You know, I'm 73, you know. I remember you used to go to the doctor. That was it. You had to pay anything. I also remember you went to the doctor, there was a copay. I also remember that you went to the doctor, there was a higher copay. I also remember you went to the doctor, and then there were certain groups that you had to go to, like HMOs.
Yeah.
Those. So
Right.
there have been changes that have been going on, just like the telephone, you know?
Yes.
So there are, you know, so people have different levels of trust and different levels of understanding. And one of the things that I was aware of in one of the groups I was in, it was a black group. All the people in the group had health insurance, but there were two people who had children that were older than 18, and they were concerned because they didn't have health insurance. And there was another person who had a mother who had minor mental illness and didn't know what to do and didn't know how it fit into her health insurance. So they got some answers and some guidance. So it's simple. We don't know what we don't know.
Yeah.
So our intent is to help bring the information to people where they are. All right? And that, from a cultural standpoint, is very, very important so they can understand and see what's available for them and then, you know, move on from there and say, yes, let's take this in. So even though I was an HMO, rather than just going to the doctor, help people understand what that is. Same thing with the car. You have a car, how often do you get the oil changed? If you don't get the oil changed, well, you may go 10,000, 15,000 miles, but soon there's not going to be any oil left. And what do you come up with? You come up with a blown engine. So rather than spending $30 to get an oil change, now you're faced with $3,000 or $4,000 for a whole new engine. So there is some logic to it, but people need to understand that logic and practicality.
Yes.
Can I add what now and resources?
Yes, Chi.
You know, I worked last week, Saturday and Sunday. Usually Saturday and Sundays is the day and the time that people can come because they're working, you know, during the weekdays. So they usually come to me for help with Saturday and Sunday. And then I have problems. I found out that Access Health Connecticut is not open on Saturday and Sunday. I wish that we have Access Health CT people here. But I called them, they say that they only open Monday to Friday. So That's the resources that I'm talking about, that we should request resources to help access city people working on Saturday and Sunday, especially during the enrolling period. That's one thing.
Yes.
The second thing that I think that we should ask for it is we should have a direct line for a sister to Access Health Connecticut. Because every time I call the Access Health CT number, I remember in my head 4325, the last four numbers, 855 and 805, 43, because I called so many times,
right.
and I have to be on the phone for 1 hour, 1.5 hours. If I have to wait that long, how could I help many people that come to me? So I think that's the second request that I think that we should voice to Access Health City. We're talking about resources, we're talking about what now?
Yes.
Those are the two that I think that we should.
Yes.
The third thing is that even I'm a sister, I did not get enough training. I don't think that anyone get enough training. I have so many questions. And let's put it this way. I'm a tax accountant. I prepare taxes for people. I still have questions regarding to federal tax credit. And I'm a tax accountant. I've been
Yes.
doing business, doing tax preparation for 30 years. I have questions. So I'm pretty sure that for a normal person or a normal sister that don't have, tax background, probably have tons of questions. So I think that, we need more of the training for sisters. And then we should need some direct line that a sister can talk directly to an expert in Access Health City. So that's the resources
Yes.
I'm talking about, and we should attack that.
Yes, I mean, we've had, I can look at Angela, we've had many conversations over the last year, and it emphasizes for other folks who weren't directly involved in open enrollment the challenges and the real barriers that these sisters faced, and they were myriad, and they were continuous. And so they really, I take every opportunity just to applaud people. But I just want to talk about the three things that you said, because the first, it sounds simple, the issue of having a call line that's open on Saturday and Sunday. And for folks who don't know, that call line, there's someone on the other end who's also trained and can assist someone when they're having trouble with the website, right, with completing the application and asking a variety of other questions. And that really is an issue. It's many issues, but it's an issue of cultural relevance, right? You're serving people, you're providing a service, they're buying a product. And so you want to make it available for them when they're available, right? Could you imagine that the Apple store wouldn't be open on Saturday and Sunday? I send my mother to the Apple store because she's always asking me about her phone. And I'm trying to tell her, if you go to the Apple store, you are going to find people so passionate about that product. They're going to sit on the floor with you. They're going to build with you. They're going to pray with you, right? Because they want you to know everything. They believe that product has power and relevance in your life, and they want you to know about it, right? Well, we're not treating this product in the same way. We buy the product, but we do not know what we get. And what we really get is this card, right? And we get this huge stack of stuff in the mail, but we get this card. So just the access, the issue of the phone, to me, is an issue of cultural relevance. And now I want to talk about the other issue that you said, that you yourself are receiving people who are trying to enroll, and you are trying to be the bridge for them. You're saying, I do know a little bit more than you do. Don't know everything, but I know a little more, and I know what number to call. Let me call. And then if you do get through, you're facing another set of barriers. That also is an issue that the ACA is trying to address, and I'll say it this way, it's an issue, it's a workforce issue, because a lot of people don't understand that people access the system through others, through the trusted, right, advocacy of others, whether it's a community health worker, whether it's a medical interpreter, a family member, right? There are others that make it possible, a navigator. Other people make it possible for people to access what is not truly a healthcare system, but I know that's another conversation. But these pieces that we have that comprise healthcare, right? People help other people access. We have to acknowledge that in a real way so that we can assist those individuals. So there should be a dedicated line for you because you are ensuring that 20, 100, 200, 400 people have access to this system. And so you are of benefit to the health insurance company. You are of benefit to the system. Okay, enough said on that. The last issue is the issue of training. And you're absolutely right. First of all, the law continued to evolve. But more than that, it was the application of the law, right? It's like applied math. You know, it's one thing to learn the formula. It's another to get some math problems and actually process that information through the formula. It has to be applied. And when the law began to be applied, we found a myriad of questions, holes and pockets and a lack of information that we had to fill in. And that really is an issue of empowerment, right? So again, if you want people to utilize this system well, if you want them to understand the benefits of going to a primary care provider and developing a relationship and not going to the emergency room, you have to provide that education that is culturally appropriate, and you have to empower people to understand how to use the system. And so, again, this is the work that needs to continue, or else we're building this thing that people still won't really have access to.
And if I just might add, you know, and I think here's another fine example. You've heard your expression, think globally and act locally. You are acting locally, and that's what cultures, that's what people need. Denise just gave a great example of what we need, but we do have something in place. It's not what we would like for it to be, but there is something in place, and we cannot minimize that. It's important to take what's already in place and continue to use it and expand it until something better comes along. That's why you're here. That's why everyone is here. One of the first things that comes up when something gets ready to, you get ready to change something is, oh, we need money. No, we don't need money. We need conversations. This is what this is, having that conversation, having that cultural conversation. Ask a question, answer one question. It's amazing. You answer one question and 3 more come up, but you're having the conversation and helping people to understand. Use what we have as effectively as we have. And I'm not saying not to look for something else, but you make progress, people see it, and then they get on board.
And I also just wanted to add, you know, in order for us to make the changes that we want, we have to be there in numbers, right? It's going to be very different for people to, or agencies or entities to listen to smaller groups, but if we're able to combine our forces, and that means all of our communities coming together and saying, these are the barriers our communities are facing, logically it would make sense to have contact numbers for the weekend and after hours, because you're talking about enrolling people that are working full-time or part-time. They're not available during the day when the business is open. Now we have to think about after work hours, during the weekends that you're mentioning. You know, it's trying to bring this important information to the people and say, we hear that a system's in place. We are now informing you. There are glitches to this system. This is what our community is informing us. How do we work together to resolve it? How do we create a direct line for assisters? How do we create access after work hours, after 5 o'clock, during the weekends? How is it that we're able to come together in a partnership and really address some of these issues?
So I want to thank all of the panelists for all of their great insight today. Let's give them a round of applause. And I want to say, if you haven't already given me your index card questions, feel free to turn them in after the panel disperses, because we're going to try to address the questions in a follow-up event. But we won't have time to take any more questions from the audience. So I think, you know, based on what the panelists were talking about, we definitely want to give you all time to talk to one another, to talk to the panelists face to face. And so I want to ask you to, once again, split up into the groups that interested you before. Each of the round circular groups have a notepad, a flip chart on which there is an issue that is presented, that was identified during the community conversations this summer. So if you could split yourself up into those groups, we're going to have the panelists come down, and then we're going to continue with the program. Yes? And you're right, so you have 5 minutes to do that.